Hello, everybody. It's Chandra, or back to me, here on YouTube. And guess what? I am back to me. Guys, listen, I'm going to preface this. This is going to be a long one. I haven't talked to you guys in probably, it's been about 3 months, maybe, I would think. And this one, I'll tell you what it's going to be about in the beginning. So if you don't want, if it doesn't interest you, you can turn the video off. That's fine. You won't offend me at all. This video is going to be mainly about plastic surgery, what to expect, what I had done, etc. Especially pointed at plastic surgery after weight loss, severe, extreme weight loss, right? So, let me just preface this like I always do. I've missed you guys. I've missed doing this. It's been a while. I've come back from the dead. I had vertical sleeve gastrectomy back in December of 2014. So we're talking 9 years ago. Ended up having, losing a bunch of weight, ended up having a form of melanoma. So I had to go through some procedures with that, gained the weight back. And then in September of 2020, so 3 years ago, a little less than 3 years ago, I decided to go back under the knife again and have the SADI procedure. That SADI procedure is kind of like it was a revision, right? So they went in and kind of did some more stuff, and I lost about 80 pounds in September of 2020. Fast forward to July of 2021, so exactly 2 years ago, I went on the GOVEE injection. Listen, don't judge me. Some people are like, yay, GOVEE, Mounjaro, Ozempic, Victoza, blah, blah, blah. And some people are like, I don't want to do that. No to GOVEE, blah, blah, blah. Listen, whatever works for you. If you don't want to do GOVEE, if you don't want to do Ozempic, don't do it. It's easy. Right? Just don't do it. I did, and that shot sent me into weight loss mode tenfold. I balanced out. I started my journey, my weight journey, back in 2014, and even up, because I gained weight, even up to 2020 again, I was running 365. I am 5'11", so I'm tall. So I can adjust my weight accordingly, but still 365, even if I am 5'11", even if I'm 7'8", that's still a lot of weight for a female or a male, to be honest. So I needed to lose a lot of weight. I am down now 205 pounds I've lost, and I'm sitting right at 160, 161 is what I weigh. So I'm right now in, what is this? This is the end of July 2023. I am 5'11", and I weigh about 161. I go back and forth between like 158 to 163. If I get below that 160 mark, once I start hitting 159, 158, I start kind of freaking out. I don't think that's a healthy weight for me. People carry their weight differently. And so I think where I'm at right now at like 161 to 165, it's a pretty good weight. I'm in a size medium to large top, and I'm a size 8 to 10 pant. So that's the background. I am in Austin, Texas, and I've always said it, and I will continue to say it. If you are looking for weight loss surgery, such as the SADI procedure, the vertical sleeve gastrectomy, fly your little butts down to Austin, Texas, and go see Dr. Stephen Fass, F-A-S-S. Best doctor around. The biggest cutie patootie you'll ever see, and greatest bedside manner ever. Great guy. Go see him. Anyway, okay, so I got that out of the way. Did the shots. Still do the shots. Because you know what? For those that say, oh, I'll only have to take it a year or so and then I'll get off it. No, you won't. This is a lifetime thing, guys. They've all said it. The doctors have said it. All the researchers have said it. You get on that shot, it's for life. Period, point blank. If you don't want to do that, try something else, because it won't work. So yeah, that being said, if you want to commit to doing the shots, commit to doing the shots. That's what I did. Been on it 2 years, down 205 pounds. I lost all of that weight within maybe a year and a couple of months, year and a half maybe. So I've been plateaued for a while. So transition after the plateau. The last video, I don't know that you saw of mine, when I was like, hey guys, you know, my journey started here, I've ended up here, what's the next step? Well, I did it. I had plastic surgery. Yep, I'm shallow. Yep, I did it. Let me tell you what I did. I flew from Austin to Jacksonville, Florida. Not Miami, Florida, where they say all the, you know, the butcher plastic surgeons. I didn't go there. I didn't want to risk it. No, I didn't go out of the country either. Some people have great experiences out of country. I live too close to Mexico. No, thank you. I'm not going to do it. So anyway, I kind of went to a couple of surgeons here, got some costs. And I had an acquaintance of mine that said, hey, I'm going to Florida to this surgeon out there. And this person that I knew lived in Arizona. So I was like, okay, well, you know, go do it. Tell me what you think. Because I was still like in the learning stages. She came back. She did really well. She ended up having a breast augment and tummy tuck. So breast augment is just implants and a tummy tuck. She was younger than me. I needed more than that because I was a melting mess. So I was like, you know what, if I'm going to do this, I want to lay all my procedures out and just knock out as many as I can at once. If I'm going under, I may as well get it done, right? Insurance doesn't pay for plastic surgery, cosmetic surgery, right? Now, if you have a sagging apron or something like that, yeah, they pay for it, but not for what I wanted. They didn't pay for any of it. So this was all out of pocket. So what did I want to get done? I wanted, in theory, I wanted to do a breast lift and implants. So breast lift and augmentation. I had lost so much weight, my boobs were pancakes. And you girls, if you have the pancake boobs after you've lost a lot of weight, you know what I'm talking about. I went from a double D breast size when I was fat to barely a B flat. I was a B flat. And I just, honestly, I felt like I lost my sense of womanhood. Does that make sense? Like, I felt like I just wasn't a girl anymore. I had had these boobs all my life. Yeah, it was because I was fat. But I'd always had them and I always got compliments on them. And I just felt like I was missing them. So I wanted to get that done. The other thing that happens when you lose a lot of weight is you get bat wings, flabby arms, blah, blah, blah. And a lot of people think, oh, I can just work out and tone them. When you lose 200 pounds, you're not toning that. My upper arm circumference was 17 inches around at its biggest. And I can't lift now, and I'll go into it later. But if you look right now, they're pretty tiny. They are 9 inches. So I lost 8 inches on my upper arm. They're very tiny. In fact, the circumference of my forearm is 9 1/4 inches. So technically my forearm is 1/4 of an inch bigger than my upper arm. So I'm Popeye. So that's that. The other thing I wanted to do is I was sitting there pondering a facelift because, you know, you lose a lot of weight, you're at my age, you get the lower hanging fruit, right? All of this. And so I went in and he said, listen, that's going to be a whole new surgery. I wanted to do lipo, but he's like, you don't need lipo. There's no fat. It's just skin. You'd have to do a full, you know, facelift. And I just didn't have the time or the patience for that. So instead, when you lose weight, the fat from behind your eyes tends to come out from behind your eyes, which causes fat pockets. Now I'm going to take my glasses off. Keep in mind, guys, my eyes are still not healed all the way. So I don't know if you can see this, but under your eyes, right here, I don't have them anymore. But if for those of y'all that have lost a lot of weight, you may notice that you've instantly gotten these fat pockets under your eyes. What it is when you lose the weight, you have fat in your eyes too. And that fat comes out when you lose the weight here. So what I did is I had them suck the fat out from under my eyes. It's called a blepharoplasty. Some people have an upper blepharoplasty where their lid hangs down, and then a lower blepharoplasty. I just had a lower. So that's a blepharoplasty. The arm lift is called a brachioplasty. So I had a lower bleph, I had brachioplasty, I had a breast lift, and I had a breast augment. So 4 procedures. How did I do? Well, I'll tell you. In my last video, I wasn't sure on what size I was gonna go for in my boobs. Well, we ended up deciding. So when you get implants, they don't say, you can't say, oh, I want a double D. And they just give you a double D implant, right? You have to get, it's the amount of cc's in the implant. So he said, well, what size are you looking for? And I was like, I kind of want a double D. That'd be nice, right? So for me, that ended up being 685 cc's in each breast. There are also several kind of breast implants you can get. Right now, the 3 that I had, now guys, listen, I am not a doctor. I don't play one on TV, and I don't know my shit. I don't. But I can tell you what I do know and what I was told, right? So there are 3 types of implants. There's saline, there's silicone, and then there's gummy bear. Now, I chose the gummy bear implants. Those are a little more pricey. Think of a gummy bear candy, right? When you poke or you cut a gummy bear candy in half, what happens? Nothing, right? Nothing leaks, nothing spills out. It's just coagulated. And so that's what these implants are supposed to do. Do they do it? Some people say yes, some people say no. There's stories on both. You go with your better judgment. I did a high, what do they call it? A high, where they sit high. I forget what it's called. But I wanted them very, very high, and I wanted them under the muscle. So gummy bear was what it was. And I went high profile. That's what I did. I went for the high profile gummy bears. So they said, when I first had the surgery, guys, literally these guys were up to my clavicle. They were up there. So they have settled. It takes about 6 weeks. It's been 6 weeks since my surgery, and they have started to settle quite a bit. So that's what I had done. When they did this procedure, when you have a lift, they do what they call an anchor incision. So imagine your breast. They cut down the bottom of your breast and then make it looks like an anchor. So that way, and then they cut around your nipple. So what they do is they lift that skin and they build you a new breast and then stitch your nipple where it should be versus where it was hanging low. And so that's what mine looks like. It's got an anchor underneath the breast. Perfect, perfect, perfect. Not one time have my breasts given me any problems in the last 6 weeks since surgery. My surgery was on June 15th, by the way. And right now it is, what is it? July 27th. So we're looking at a month and 12 days, right at 6 weeks, a little less than 6 weeks. So anyway, that was the breasts. So he did that. Everything was great. There were a couple of sutures that I had to go back, and my nipples that they had to go back and remove after the fact, but it was painless. I also, on my blepharoplasty, he did that. I'm not gonna lie. For those that are thinking about a lower blepharoplasty, it sucks getting the stitches taken. Not the stitches, well, yeah, the stitches taken out. So what he did is they go into your bottom eyelid, take the fat out that way, move the skin up and cut the extra skin out, and then they stitch it, right in there. Well, with that stitch, it's like a piece of thread, like if you're stitching a shirt or hemming some jeans. They stitch it all up, and then they have the extra string that comes out through like by your tear duct. And what he did is he taped it up here on both eyes. So both eyes were stitched, and I had 2 blue strings that were taped right between my eyebrows. So I went in probably a week after the fact, and he took the tape out and he ripped that string right out from my eyelid. I am not going to tell you the worst pain I ever felt in my life. Worse than childbirth. So consider that. I also had, so I ended up having retraction, and you could probably still see it in this eye. It's where your eyelid droops kind of right here. And so it takes a while. I'm doing muscle strengthening exercises with it right now. But he had to do 2 sutures on the outside of my eye because it was drooping so bad. I flew back home to Texas, and I had one of my oculoplastic surgeons out here just go and kind of snip those sutures out once I got home. But the eyes are doing fine. That was severe pain, but it was only for 2 minutes, and my eyes have been healing great ever since then. So that's that. Let's talk about the brachioplasty, the bane of my existence. The arm surgery, the arm lift, the bat wing removal, that. If you're thinking about a brachioplasty, listen up. I'm going to tell you what you need to know beforehand. You need to have yourself a really good friend, or a husband, or a wife, or a spouse, or a child that's old enough to take care of you for at least a month. I still have to have my husband. It's been 6 weeks. At least a month. And I'm not saying coming in and checking on you once a day. They need to be there for you, because you cannot do a thing. You cannot lift your arms. You cannot reach for a plate in a cabinet. You cannot bend down to grab something. You cannot change clothes. You cannot put your arms into shirts. You cannot reach down and pull up pants. Guys, this is a surgery that I way underestimated. Is it worth it now? Yes. Am I glad I did it? Yes. Had I known beforehand what it entailed, it would have probably scared me off, and I wouldn't have done it, because it's a lot. You can't wear deodorant. Hi, I live in Texas. It's 115 degrees, and it's been like this for 45 days straight, and I can't wear deodorant. I stay inside a lot with my arms down. If you've noticed, when I've been talking, I've had my arms down a lot. Here's what happened. So when you get the brachioplasty, they literally, your doctor will either cut in the back of your arm or on the inside of your arm, from your armpit down to your elbow. Some people get, I forget what it's called, extended brachioplasty. And that goes even further down, and it'll go down past your breasts. I don't know how those people live. Listen, I'd like to consider myself a pretty tough girl. Let me show you. I'm going to show you this. So before I show you, so there's a lot of things that can happen after, and it's normal, but it doesn't mean it feels better, and it doesn't mean it makes you feel any more secure about your surgery. So one of the things that happen a lot after a brachioplasty, because you use your arms, like you're going to lift without thinking, right? You're going to go and grab something without thinking. One of the things that happens is people get holes in their armpits. Holes. Guess what I got? One in each armpit. A hole. It did not appear until 2 weeks after surgery, maybe even 3 weeks now that I think about it. And it's about the size of a regular pinky nail, not my big long claws, but just like a regular pinky nail, and it's an opening. And you have to worry once it starts tunneling, and one of mine had started tunneling. So I was already back home. My plastic surgeon, remember, is in Florida. I'm here in Texas. And so I've been on the phone with them every day. They've been amazing. And they got me some betadine ointment and one of those rough gauze pads that pull out the junk. So I've been packing my holes with betadine and gauze, and I have to change it twice a day. And my husband's been doing it because obviously I can't lift my arms. Another reason why you need someone there. So there's that. Another issue that I had is we had put scar tape on my right arm incision, and it's literally once the incisions have all closed on your arm, right, where there's no scabbing, no bleeding, nothing. There's a scar tape that you can use, and it's super thick scar tape to help flatten your scar and make your scar go away. Well, I think I put it on too soon because that scar tape would not remove. It was stuck, and literally after shower, we're looking 10 days, it still wasn't budging. So I had to rip that tape off to get some air on my incisions, and it's not fun. So there's a Facebook page that is all things brachioplasty, people that have had the surgery, people that are thinking about the surgery. Highly recommend you join that if you decide you want to look into brachioplasty, because it has been a godsend for me. I mean, yeah, there's people in there that are a little dramatic, and there's some people that, there's one girl on the page, by 10 days post-op, she's in the gym lifting weights. How the fuck do you do that? I am sorry about the language, but Jesus Christ, I am 6 weeks and I still can't lift my arms. I don't know how she did it, but God bless her. Because I can't even put on a shirt. I have to wear these tube tops because I can't raise my arms, so I have to put a top on and wiggle it up at 6 weeks. So God bless it. If you can do that, great, but there's just no way. But I mean, the thing is, you get both sides of the good, the bad, and the ugly, and it really, really helped me. Thank God I did not know about the recovery time when I was looking into it, because I wouldn't have done it. So let me tell you what I did. I'm going to show you this. So right now, once I got the scar tape off of my arm, the people on the board had said, hey, use micropore tape. And what it is it's paper tape. You can get it skin color or you can get it white. And it's on Amazon, and it's like $4 a roll, score. And you can just put it over your incision, literally the 1/2-inch piece of tape, you put it on your incision and seal it up. And then when you get in the shower at night or in the morning, you can just peel it off and it doesn't hurt. And sure enough, it doesn't. And I wish I'd have known about it before I put on that damn scar tape, because I think I set myself back. So let me show you what this micropore tape looks like, right? Here, I don't know if you can see it right there. There is the tape. And it's skin colored. You can see I have an opening down at my elbow too. And then these right here are covering my little holes that I have in my armpits. So that's what that looks like. There, I don't know if you can see the scar. So I have a seroma right here, which is kind of, it's water filled, but it's slowly coming out. It's fine. But I have the tape on my incision, the micropore tape, and then I have this guy covering my armpit and the hole in my armpit. Breasts. Here are the breasts. I don't want to YouTube to get me kicked off, but these are, right now, I went to Victoria's Secret the other day, and I am setting at a 34 triple D or a 36 overflowing double D is what it is. Oh, that hurts. Okay, so yeah, so like you say, 6 weeks, you can tell there's still a bunch of junk going on. But tiny arms, right? Little arms. I've got big old boobies. Like you say, this is I think this is a medium tube top. And these jeans I just got from Express, they are a 10, I think. So I'll show you my eyes. I'll get up close so you can see my eyeballs. You can see they're still a little droopy. That's to be expected. So they said your eyes will not go into their regular shape probably 3 to 4 months, if not even longer. You can see right here, I don't know if you can see that scar. This is where that stitching was, all in there. And then on this side, they added the extra suture. trying to get you to see it. They, right here, they added that extra suture right there. So, and then there's the incision from that. But they just went in, sucked out the fat, pulled the skin up, cut the rest of the skin, and stitched it. So it's basically like a tummy tuck of your eyeballs. And if you'll notice, I don't know if you'd seen my videos in the past, but my eyes definitely have taken on a new shape. And the oculoplastic surgeon said they're going to continue to take a different shape until they settle. So I'm not wearing any makeup right now. I don't have any filters. And the eye bags are gone, which is exactly what I wanted, right? I mean, that's exactly what I wanted. So that's that. That is my journey so far. So what happens next? I don't know. I mean, you guys that have followed me since the beginning of this whole entire journey, right? Go back and look. You'll see my videos from 2014. I was big as a house. I don't know what life is like without worrying about weight, or without worrying about fixing the flabby skin from losing the weight. And I'm pretty happy. I don't, I'm over here looking right now. You guys, this is my office, so, and my Peloton room. So, this is, hasn't been used very much in the last 6 weeks because I've been healing. So I have done several Shein hauls. If y'all don't know about Shein, get to know Shein. SHEIN.com. This is not a paid advertisement, but I do love myself some Shein for clothing. And I have 28 shirts that I'm looking at right now in bags that I still can't wear that I've bought from Shein because you have to put your hands, your arms in, and I can't lift my arms yet. Give me a week and a half. Maybe I'll do a Shein haul video for you guys and show you what my new girls look like in Shein larges. I went from a 3 to 4 XL now to a medium large, which is bananas. Before the boobs, I was setting at a full medium. But, first world problems. I have big boobs. Another thing I was going to tell you, I know I get asked a lot, is what was the cost? This will tell you exactly why I went to Jacksonville. Here in Austin, just for a boob lift, and implants, and when I was thinking about a tummy tuck, just for that, was $33,000. And so I started getting at cost estimates and decided to do my arms and my eyes, and it ended up being, for all of that, $38,000 here in Austin. I was like, there's no way. So I started, like I say, the girl that I knew that went to, sorry, I'm shedding hair. The girl that I knew that went to Florida, she's like, this guy is great, and he's really cost effective. And I was like, well, how much was it? Well, I did a Zoom call with him because he does Zooms. And for all of the procedures I did, including, I forgot to tell you, 2 Juvederm vials. So I had my lips filled again. I'll show you. Y'all all know that I am a lip filler girl. I had my lips filled, and I had these guys, I forget what they're called. These, that's my dimple thing, but I had these big lines here. He filled those, and then my lips with Juvederm. So I had 2 vials of Juvederm, which in Austin, they're $800 a vial. So that's like $1,600 in itself here in Austin. Plus a breast lift, breast augment, brachioplasty and blepharoplasty. All of that, including surgeon fees, including operating room fees, including anesthesia, including recovery, including medication, and including all the garments that you get after surgery. Take a guess. $15,000. I said, you know what? Sign me up. So my husband and I got on a plane. We went to Jacksonville. We stayed in an Airbnb for 10 days for pre-surgery, surgery, post-op, and then we had to stay an extra 2 days because of my eyes. Stayed in an Airbnb, rented a car, did everything under the sun. I would say all of that was under about $21,000, signed, sealed, delivered, for the surgery, everything, 21. And Austin here wanted to charge me over 30 just for the surgery itself. For those of you that want information on my surgeon, let me know, comment, I'll give you his information. I don't want to just blast him out like that, but he's amazing, kindest guy in the world, knows his stuff. And yeah, so if you want his information, let me know. Good guy, and he has the best nurse ever. Her name is Montana, and she's the cutest, tiniest little blast in a glass you will ever meet in your life. Great bedside manner, all of them there. It's a small place, and there's only, I think, 4 people on the staff there. Just really great. So if you can get to Jacksonville, get you some plastic surgery like I did. Anyway, guys, this is 31 minutes. I usually keep it at 10, so I've talked. If you have any questions, don't hesitate. I'm going to be on more and more, like once things settle, no pun intended, and I start getting back to normal. I just didn't want y'all to think I had forgotten about you. I know I've been promising updates on this plastic surgery, and so I just wanted you to know I'm still here and alive, and things are going great. It just this is a long healing process. So with that being said, I am going to strip back down into my PJ shirt and get these jeans that are sucking the life of me off. I love talking to you guys again. Man, I've missed this. Reach out to me if you have any questions. And Chandra with the plastic surgery signing out for a little bit, and I will talk to you guys soon. Bye.